Okay, let's go ahead and get started, everyone. There may be a few folks who may still be joining us, but I can go ahead and start with my update, and then we can kick it over to others as they join. All right, so I'm going to do a quick screen share, and first I'll just introduce myself again. I'm Lori Christenson. I'm the Gallatin City County Health Department Health Officer, and I'm going to start by sharing our most recent weekly surveillance report. Can everyone see that okay? Thumbs up? Perfect. Okay. Okay, so here we can see a little bit of a increase in our rolling 7-day average of cases per 100,000 residents here in Gallatin County. So this is a little bit of an increase from the average that we were seeing the week previous. And I want to take a quick moment to also just quickly explain the difference between the average cases and so the rolling average cases versus the total cases, which is that criteria that we'll talk about here in a little bit, set by CDC to determine when masks should be worn. So again, just thinking about it from a really simple standpoint, when we're looking at this particular epi curve, we're talking about an average number of cases per 100,000. The criteria for high or substantial transmission is actually based on total cases per 100,000. So it's a difference between an average and the total cases. I just wanted to make sure that's really clear for reporting purposes. We can see that we have seen a little bit of an increase in our percent positivity rate from the last 7-day period. And we continue to see really good turnaround times in terms of reporting, especially when a specimen is collected, to reporting to public health. Again, this is a really important criteria, and we're seeing continued, that average turnaround is about 1 day. I also wanted to share our most recent number of individuals in Gallatin County who's received 1 dose of a vaccine, COVID-19 vaccine. Right now we're sitting at 64% for 1 dose, and for fully vaccinated, as of 7/23, we are at 55%. All right, so the next piece, this is a new addition to our surveillance report. And this again is based on that newest CDC guidance. And so what you can see here is Gallatin County is currently experiencing substantial community transmission, as depicted here in this circle here. So what that means is, and it's really important for us to understand that, you know, we can fluctuate from moderate to substantial to high with just a few cases. And so really it's important to understand as a community that we're seeing COVID-19 cases in our community rising. So really every layer of protection counts right now. And that means masking and wearing them in public indoor places, regardless of your vaccination status, especially when we as a community are in the substantial transmission category. I would anticipate that we'll remain in the substantial transmission category until we see our cases drop. So I wanted to just show this and share this with all of you. So you had a little bit of insight in terms of why the health department is making a strong recommendation for individuals, whether you're vaccinated or not, to be wearing a mask in indoor public places. And I'll have Bozeman Health, if they're available, to talk about the capacity in Bozeman Health in terms of critical care beds as well as non-critical care beds. So with that, I'll stop sharing my screen, and I'll turn it over to either Tracy or Dr. Emerick from Bozeman Health is also here on the call with us today. Dr. Emerick, I'll let you fully introduce yourself as well, but I'll offer an opportunity for Tracy to go, and then if Dr. Emerick or someone from Bozeman Health wants to share more, you are welcome to do so.
Okay, thanks, Lori. I'm Tracy Ellig. I'm the Vice President of Communications for Montana State University. I think our update is that this morning we sent an email to all new incoming students as well as to all current students, informing them of a very large incentive vaccination program that we launched today. So this is an incentive program where they can enter a sweepstakes to earn significant prizes. These are things the level of ski passes or Yeti coolers. And today was the launch. We will be communicating this throughout the rest of the summer and into the fall. We will be having drawings every single week for the fall semester. And the only way you can enter is by showing evidence that you have received a vaccine. So paired with that is our information about how easy it is to get a vaccine on campus, because we really want to incentivize students both to get a vaccine right now before they come back, but then once they get on campus to understand how easy it is to be vaccinated if they haven't yet. Thanks.
Okay, Dr. Emerick, do you have any you'd like to share?
I am Dr. Kerrie Emerick. I'm the medical director at the lab at Bozeman Health. Right now, we are starting to send specimens to the state for hospitalized patients with COVID-19 and also patients who have been vaccinated who have breakthrough cases. And the state actually does the sequencing to tell if we have the Delta variant or not. Right now, the testing modalities that we have for PCR in our lab don't detect Delta variant or UK variant, really any variant at all, because we don't test for the spike protein with our PCR test. We currently use the Panther platform and then the Liat platform, which are both PCR based, but neither detect spike protein. I don't know if you guys have any questions revolving around testing at Bozeman Health in particular.
So this may be a good time just to open it up for questions from any of you to ask of any one of us.
Yeah, I have a question for Dr. Emerick. My name is Jane McDonald. I'm with KBZK here in Bozeman. Thank you all for having this meeting today. So Dr. Emerick, as far as the Delta variant goes, if a case does ever arrive in Gallatin County, what's going to be the response and how will the public be alerted to such an instance?
I'm not really sure how to answer that. I don't think that anything is communicated through Bozeman Health. My guess is that the testing is done through the state lab, and then the state health department is alerted, and probably the county health department as well. Lori can chime in on that.
Yeah, I'd be happy to talk about that. So we've had Delta variant here in our community. We should anticipate Delta variant in our community. It's in the state, it's in the nation, and it's here. And for the COVID-19 Delta variant is currently accounting for about 80% of all COVID cases in the United States. And this variant is significantly more infectious and has led to a rise in COVID-19 cases. So our messaging on this really remains the same, which is it's important to be vaccinated. Consider your risks when you're in crowded places. And as we've just shared with you today, the importance of wearing a mask, especially even if you're a vaccinated individual indoors. The guidance will remain the same for those who are unvaccinated, that you should be wearing a mask. And so really, in terms of the arrival of the Delta variant, it is here. We are aware that it is here. And it's just really a matter of us taking some personal responsibility for keeping that transmission as low as we possibly can at this point.
Thank you.
Hi, this is Nora Shelley with the Chronicle. Dr. Emerick, I had a question. You mentioned sending potential breakthrough cases or whatever that was to the state for testing. Is that all cases of people who've been vaccinated, or is it a certain percentage? Or
We just started this week sending all cases of breakthrough and hospitalized patients. So everyone will go for sequencing. And it takes about a week to get a result back. We do not get individual patient results back because of regulatory requirements with the testing, but the state does compile that information, and I believe they give it to the county health department as well.
Okay, and can you talk about why breakthrough cases and hospitalizations are important to send away for that?
Well, I think it helps us decide if we are encountering other mutations as well. So right now we know that the Delta variant is in Gallatin County, it's in the country, it's in the state. But it wasn't before March of this year. And so as a virus, we anticipate that it mutates. That's the natural history of viruses. So sequencing these will help us determine if it is mutating again, if we're getting more mutations in the spike protein, if it's going to change from Delta variant to whatever is next. So I think it's important to do this sequencing so that we can kind of follow the epidemiology of this virus.
Okay, thank you. And I was also wondering, and this could be for anyone, I guess, I was wondering about testing rates and whether you're encountering anything with people who have symptoms getting testing. Do you think enough people are getting tested who might have symptoms? I don't know if that was a clear question, but.
I feel like our testing has increased in the last week or two. And most of that increase is probably symptomatic patients. We always had a pretty stable amount of preoperative testing at Bozeman Health, and that hasn't really increased or decreased over time in the last couple months. But we have had an increase in testing, and I'm assuming that those are symptomatic patients. And travel. We have a lot of travel in the summer, but in the last week or so, my guess is symptomatics.
Yeah, and this is Lori. I would echo that. And we do on our Healthy Gallatin website, we do have a data dashboard that kind of shows how many tests are run per day. So that continues to be accessible. I don't have the exact numbers up in front of me as either, but we are also hearing that testing is going up.
Okay, thank you.
Hello, I'm Jonathan May with NBC Montana. I don't know if I've met you guys yet. I'm the new guy here. Just looking at the statistics, I mean, only 55% of Gallatin County has been vaccinated. If we get more awareness out and people end up taking the vaccine, would we get a lid on this quicker? Or because it seems, I don't know, I was talking with my parents the other day and they're like, oh, we're vaccinated, now we have to wear a mask. So it's kind of like a loop of doom. So I don't know. What do you guys think about that? It's just for some people who might be just like, hey, I thought I got vaccinated. Why do I have to go back? You know, because I thought we were moving forward and now we're going back. So just that's the question, my question.
Jonathan, this is Lori. That is such a fantastic question, and thank you for asking it. I have heard it myself from others, from colleagues and from others. And I think it's important to remember that vaccinations continue to be the most effective strategy to prevent infection and severe disease. So those who chose to get vaccinated, kudos. Thank you for doing your part. For those who have not gotten vaccinated, I would continue to urge you to get vaccinated. Really, as Dr. Emerick just mentioned, that mutations can, as you know, if we have more virus circulating, mutations could produce future variants that could be more virulent than what we're experiencing now. So really continuing to encourage those who you care about to be vaccinated, as well as really, like I mentioned earlier, just taking all preventative steps that we can take at this time to try and slow transmission, especially if we're protecting the most vulnerable in our community. Does that answer your question, Jonathan? Okay.
I had a question regarding House Bill 257 that was passed. How will that kind of play into effect of your strategy to try to keep these numbers down with this bill giving, private businesses the ability to kind of essentially govern themselves and their customers coming through?
Yeah, great question. So because of the new legislation, so House Bill 257, the county and city commissions are considered the governing bodies and must approve at any future meeting COVID-19 regulations that may be enforced by the health department, or excuse me, by the health officer or the Board of Health. So, in terms of thinking about it from the perspective of House Bill 257, there are elements of that definitely become challenging in terms of compelling a business to restrict access to goods or services. So, I think right now the important message that I just really want everyone to hear is that we are taking all steps we can as a health department to ensure you have the education and the information and the recommendation in front of you, that wearing a mask is going to be helpful to slow transmission, to get vaccinated is going to be helpful. And we really need the community support on this.
Thank you.
I had a bit of a follow-up to that, and I'm trying to remember back to kind of all the back and forth and confusing stuff from the spring when it came to new state laws. But when it comes to a mask mandate, can you talk about if that's in the future for Gallatin County at all, kind of taking into account the new state laws on that?
Yeah, so really kind of the same answer is that the 2021 legislature enacted laws that requires the Gallatin County and the city of Bozeman to reformulate a interlocal agreement for the city county Board of Health. And to date, there have been meetings, some informal meetings at this point in time, and no timeline has been set on reworking what that interlocal agreement will look like. So again, because of this legislation, the county and the city are the governing bodies, and local regulations that may be enforced by the health board or the health officer would be going through them. Does that help?
It does, yes. I'm trying to remember back. Was there something with the enforcement piece of it that the county's powers are limited when it comes to that? If there were to ever be any sort of things passed on that?
Yeah, I mean, I think we have to just remember that there are some limitations in these new in that new legislation. So I think it will be challenging in terms of enforcement if we have to go down that path. And like I said, I would really rather focus our time and energy at this moment, focusing on how important it is for the community to step up and wear a mask if they're in indoor public places and follow this information and this education.
Okay, gotcha. And I was also going to ask, you mentioned it in the press release this morning, but obviously kids under 12 aren't yet eligible for the vaccine. So I'm wondering if you could talk about, parents of those kids, what they can be keeping in mind and what people should be keeping in mind when it comes to kids in the area.
Yeah, I mean, it's important to remember that kids from 2 to 11 are not yet eligible. So again, this is why it's important. We've encouraged that those who are 2 and 11 who are unvaccinated, or anyone who's unvaccinated, to wear a mask. And in certain settings. Outdoors, we continue to see that outdoors are lower risk environments. So that is good, and that is good news. So really, again, when we're talking about protecting our community members and choosing to wear a mask, we're protecting those who are not eligible yet, those 2 to 11-year-olds, as well as those who are unvaccinated for any reason.
Okay, thank you.
Hey, Lauren. Oops, so sorry.
I was just going to say that Kallie has been able to join us. So if she had any other updates or anything, she can go ahead and make those now.
Thank you so much. I appreciate it, Holly, and my apologies for being late to the meeting. I was late because we have just recently declared that we are in an incident again. at Deaconess Hospital or for Bozeman Health. So we are in the process of standing up our incident command again in light of the news of having the substantial level of community spread, as well as understanding that the slight increases in hospitalizations that we're seeing, which within the hospitalizations that we're seeing, the majority, in fact, I think at this point in time, all of them who are hospitalized that have been positive for coronavirus are unvaccinated. So we are focused on increasing our partnership with Gallatin County Health Department, Community Health Partners, MSU, and the other local community efforts to increase vaccine awareness, increase vaccine availability and opportunities to receive at certain venues. We are very focused on implementing the latest OSHA standards that have come out to protect our healthcare workers. Not only are we concerned about having a healthy workforce for caring for patients who are ill with coronavirus, we want to ensure that we have the continued availability and strong care services for any sort of healthcare need, whether that's a trauma, a stroke, or anything else. So with that, that's why we are really encouraging those who have not been vaccinated to get vaccinated, so that we can hopefully not see a continued steadily increase in our COVID hospitalized patients, so that we can continue to have appropriate capacity for all healthcare needs of this community. And I can answer additional questions if you have other questions.
Okay, are there other questions out there for either Kallie, myself, or Tracy, or Dr. Emerick?
Yeah, I wanted to see from someone at Bozeman Health if they could just outline what the testing process looks like right now. This is Mira with Explore Big Sky.
Sure. Are you referring to testing of specimens or specimen collection?
I think specimen collection is the correct one. Just a layman who thinks they should get tested, what should they expect?
Absolutely. So from a specimen collection standpoint, we have the availability at all of our healthcare sites at this point in time. We have urgent care both in Bozeman and in Big Sky at our Big Sky Medical Center, as well as in Belgrade. So showing up to any one of those urgent care sites, they can be tested. We also have our COVID hotline, and that information can be accessed on bozemanhealth.org website. If they call the COVID hotline, an order can be placed, and then that specimen can be collected at any one of our sites. Also, if individuals would like to receive a test, they can call their primary care provider, and that order can be placed for testing as well. As of today, we do not have the drive-through option on the Deaconess campus for drive-through specimen collection. We're going to continue to monitor that. We had a decreased use of that drive-through site, so and we have had the need to disperse our staff elsewhere so that they can participate in specimen collection in other locations. So we'll continue to evaluate that, but right now individuals can have drive-through testing in Belgrade, and then they can come and walk in very easily to the Deaconess campus to be collected to the urgent care on Main Street, and then as well as at Big Sky Medical Center for testing.
Do you know what the turnaround time is right now?
I do. I know that it's less than a day.
Okay.
So Kerrie, can you speak to that? This is Dr. Emerick, the director of our lab, and she can give a lot more information on that.
Well, I can certainly try. So in May or June, mid-June maybe, we stopped doing the PCR testing on the batch analyzer. which usually took a day or two to result. And so we've moved to all rapid methods. Right now we do a rapid LIAT test, which is a LIAT flu, COVID, multiplex test. And that takes about 20 minutes to do. We also have, instead of using our batch analyzer, we're batching specimens on the Panther, the Hologic Panther, and that takes 3 or 4 hours to get a test result. So we're doing most of our pre-ops that way. Most of the ED specimens are being run on the LIAT. So somebody who walks into the emergency department will get a rapid test, probably a result within 30 minutes. In the urgent care setting, it's a little more complicated to assess the actual turnaround time. And it depends on the volume of patients who are being seen at that time. We have, I think, 4 or 5 LIATs at Main Street Urgent Care. So we are able to do 5 every 20 minutes. But with staffing, it might take a little bit longer than that. So we're looking at maybe an hour turnaround time at Main Street Urgent Care. Depending on the volumes, it could be quicker. But if they get overwhelmed at Main Street Urgent Care, they ship the specimens to the main campus and it could take a couple hours. So I think the bottom line from what Kallie was saying is that it's pretty much same day turnaround time.
And then if individuals are signed up through MyChart through Bozeman Health, they will get those results sent directly to an app on their phone, or they can look them up at the MyChart website, which will expedite their retrieving of those results.
Any other questions out there?
We went over this kind of right at the beginning of the meeting, but we all kind of said that we are in the substantial transmission status here in Gallatin County and the Gallatin Valley. So if we were to go to the high transmission status, what would that look like? What would somebody down the street, how would they know that we are now in this high transmission status?
Yeah, that's a great question. Thanks for asking it. So on our Healthy Gallatin website, we'll be sharing out information so that individuals can see kind of where we are in terms of transmission. Moving from from substantial to high or high to substantial at this time doesn't really change the recommendation in terms of wearing a mask. The CDC guidance doesn't change what happens from substantial to high. That recommendation changes when you're in a moderate or low location where masks for folks who are fully vaccinated wouldn't be recommended in that level of transmission.
Thank you. And to kind of switch gears slightly to talk a little bit more about Montana State University and the students that are coming back. We're having students back from all 50 states, some from out of country. So how will the university, I guess, conduct generally? Will there be a bigger push for masks being worn? Will there be any virtual classes, dorms? Tracy can probably speak the best to that.
So again, we launched a vaccine incentive program this morning, and that's going to run all summer. And we're going to push really hard on that to encourage students to get vaccinated now, or if they're not, that they take advantage of the ease of vaccination once they arrive on campus. We will continue to have testing, symptomatic testing on campus. We have symptomatic testing right now for students, and we'll continue to have quarantine and isolation protocols for students living on campus. We'll continue to have ubiquitous hand sanitization centers across the campus, and lots of communications. Since the start of the pandemic in 2020, Montana State, as well as all of the other campuses of the Montana State University system, have operated under the direction and the authority of the Montana Board of Regents and the Office of the Commissioner of Higher Education. and we will continue to do so. And, we're in constant contact with the commissioner's office about local conditions, as are the other campuses. But any significant change as to what will happen on the campuses will ultimately come from either the commissioner's office or from the Board of Regents. I do want to just put one thing in context. I mean, people always talk about 16,000 students coming back, but we have more than 140,000 visitors deplaning at Gallatin Airport every single month. So we are seeing a very significant number of travelers coming through our community right now that actually dwarf the number of students that will come into our community.
Thank you very much. That actually leads me into another question, kind of for anybody that would like to comment. Since this is peak tourist season and a lot of folks are coming in from outside of the community, do you think that has a play in kind of the rise in cases that we're seeing? Do you think it'll taper down once maybe October, November hits? Sure, you'll have your occasional skiing tourists come through, but it might not be as hot, for lack of a better word, than it is right now.
I can try and take a stab at that. So it's a hard question to answer because, I wish that I had a crystal ball, but I can say when we were looking at where our epi curves were last year, we definitely did see a little bit of an uptick, around July, and then it kind of came down for a little bit. And then, as people there's a lot of factors in play here. Vaccination is one, but as people also move into indoor settings, that can also change the way that this virus is more easily transmitted. In those indoor settings, there's more risk in those settings. So I think that we should remember to be diligent as we move into the fall, because it's possible based on what we have seen in the previous fall that we could see another a bump in our epidemiology.
Thank you.
I had a very quick one. Dr. Emerick, I see your last name on the Zoom thing, but could you spell your first name if you don't mind?
Sure, it's Kerrie.
Awesome, thank you.
You're welcome.
Well, if there are no other questions, I just want to really close by stressing that it's important to remain diligent. It's also important, we've learned a lot throughout the course of the pandemic, to stay kind to one another and remember really that we can do great things as a community when we work together. And I do know that news of pulling out the masks again is frustrating. I really also had hoped that we wouldn't be at this point. The pandemic does continue to pose a threat to our community's health, and we need to collectively work together to slow transmission. So I just really wanted to make sure we ended on that, and just know that we are right there with you. We would like to see our cases continue to drop. So with that, that is all that I have today. If there's nothing else, we'll go ahead and end today's conference. And please know that we appreciate the work you all do, and know that you can reach out to us if you have any questions. All right. Thanks.
Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thank y'all. Nice meeting y'all.